Hello, my name is Margot Guion and I am the Director of Prevention Services at First Call. Today I'm going to talk to you about marijuana, young minds, young bodies, and how they interact. Marijuana, also known as cannabis, is one of the most popular illicit drugs worldwide. In the United States, the percentage of people 12 years and older who have used marijuana in the past year has steadily increased. Marijuana, or weed, is a greenish-gray mixture of the dried flowers of cannabis sativa. Some people smoke marijuana in hand-rolled cigarettes called joints, in water pipes called bongs, or in blunts, which is marijuana rolled in a cigar wrap. It can also be mixed into foods or edibles such as candies, cookies, or brownies. Vaporizers have also become a more popular and frequently used method to consume marijuana. With the growing popularity of vaping devices, teens have started vaping THC, with nearly 4% of 12th graders saying that they vape THC daily. When marijuana is smoked, THC and other chemicals pass from the lungs into the bloodstream, which rapidly carries them throughout the body to the brain. The person begins to feel effects almost immediately. Many people experience a pleasant euphoria or sense of relaxation, while others may experience anxiety, paranoia, and a sense of feeling out of control. If marijuana is consumed in food or beverages, these effects are somewhat delayed, usually appearing after 30 minutes to an hour, because the drug must first pass through the digestive system. While euphoria is the most well-known effect of using marijuana, there are many cognitive, physical, and other acute effects. Cognitive effects include impairment of verbal learning and memory, attention, inhibition, and decision-making. People who have taken large doses of marijuana may experience an acute psychosis, which includes hallucinations, delusions, and a loss of the sense of personal identity. There are several cases of those who have had a visit to the emergency room due to high THC ingestion, resulting in an overdose. Regular marijuana smokers may be at a higher risk for bronchitis or poor lung function. Users, particularly those who suffer from cardiovascular issues, are also at greater risk for stroke or other complications. There are many reasons marijuana has become a bigger problem with our youth today. Youth's perception of harm involved with marijuana use is declining. This is where understanding the risk factors involved with substance use comes into play. The DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, defines an addiction to marijuana as cannabis use disorder. Abrupt cessation of prolonged and heavy cannabis use is associated with a variety of withdrawal symptoms, including headache, sleep disturbances, irritability, and anxiety. Individuals who initiate marijuana use in adolescence are more likely to develop a cannabis use disorder within 2 years of first use than those who initiate use as adults. Addiction involves craving something intensely, followed by a loss of control over its use, and continuing to use despite adverse consequences. When a person is addicted, they are actually becoming dependent on the substance, which impacts brain function and development. First, it disrupts the way it registers pleasure, then it corrupts other normal drives such as learning and motivation. It is so important for adults to keep a constant line of communication with youth regarding drugs and alcohol. Adolescents do look to their peers, but the relationship they have with the adults in their life is the most important. The best tip I can leave you with is to keep talking with the youth in your life and do not stop. While they may not always show it, children and adolescents do value the opinions of the adults in their lives. Thank you so much for your time today. If you have any questions or are interested in getting more information, please talk to your school nurse, counselor, or social worker, or myself.